and even if you treat the external swelling, the child is not going to come back for the rest of the treatment because the parent is too busy. Namaskar dentist, I am Dr. Deepesh Prajapati, pediatric dentist, practicing exclusive pediatric dentistry in Jaipur, Rajasthan since year 2013. We being pediatric dentists, we all know that how difficult it is to manage the kid and the parent at the same time. So this video I have made just to explain that what are the 4 common parenting styles and what tips you can pick from the each parenting style and accordingly modify your behavior towards that particular parent so that the treatment of the child goes smooth. The first parenting is authoritative. This is considered to be the best kind of parenting world over. These parents have lot of warmth and little firmness in their parenting style as well. They have lot of time for their kids. They have lot of social reinforcers, activity reinforcers for their kids. They take the child to the park, read story books, at the same time doesn't allow them to eat too many junk, too many chocolates, and the screen time is also controlled. So what is this usually will find that such kids do not have cavities and other health issues as well. So this is considered as the best parenting, and kids who grown out of an authoritative parenting are well established in their professional and personal life later on as well. The second type of parenting comes is authoritarian. I mean, as the name suggests, these kind of parenting styles are run by rules. If the parent has said you have to wake up at 7 a.m., you have to wake up at 7 a.m. If the child doesn't want to wake up at particular day at 7 a.m., he is not allowed to reason that let me sleep, for little more days, because the parent probably has been brought up with the same parenting style, so they are trying to put the same parenting style to their kid as well. They have little warmth in their parenting style, and the child usually is very well behaved, doesn't creates mischief inside and outside house in social activities, but as soon as the child moves out of house, later in the life when the parental control is off the hook, usually these kids tend to do lot of antisocial activities and face problems in their social and personal life as well. I believe again because they are led by rules, less likely these kids gonna have dental cavities. The third type is where I feel most of your patients will be grown up through this parenting style, which is indulgent. These parents have lot of time for their kids but no firmness on their parenting style. They let the child eat whatever he or she wants. They let the child have night feeding as long as the child wants, because the parents are fearful that if I don't give it, the child will cry. And the child crying or gagging are 2 tools which the child often use to get their things done at home. And these kind of kids are again the most difficult kids whose behavior guidance becomes difficult and takes lot of time, and at the same time the parent doesn't want you to be firm with the child. These kids also face problems when they go to school. They have to follow certain rules led by teacher or the school authorities. They find it really difficult to follow rules because they have not been subjected to any rules by the parents at home. And these kids, I believe, as I said, have cavities in their mouth because their diet is not controlled, their oral hygiene practices are not controlled. And again, these kids, when they move later in their life, are more likely to get into substance abuse. The fourth type of parenting is neglectful. These parents are too busy in their social and professional life. They do not know exactly what is going with the kid. They don't have time to spend with the kid. So usually they do not realize that what the child is eating, how the child is brushing. And again, second category, I would say the child will have cavities, but again the parents will not have time to treat such cavities, and these kids will usually come with full-blown full mouth cases, big extraoral swellings, and even if you treat the extraoral swelling, the child is not going to come back for the rest of the treatment because the parent is too busy. These kids are expected to have behavioral problems. These kids have very low self-esteem. These kids are expected to have issues when they grow up in their behavior, professional and personal life. So after seeing this video, I hope that you will be able to classify parents depending on their parenting style, and it will help you to grow as a clinician, that how to tackle a particular kind of parent and expect and not to get annoyed yourself with the kid, understanding that what kind of parenting he has been through, and that's why how the kid is. So being a pediatric dentist, my advice is do not lose your patience on any kind of kid or parent. Pediatric dentistry demands lot of patience. If you have any other doubt regarding pediatric dentistry or psychology, procedures, materials, anything, you can leave your doubt in the comment section or leave me an email given above. I'll definitely try to help you. Namaskar.